lot of the people here are not necessarily familiar with funding when it comes to DNH. So my question is it going to be possible this year to increase the amount of PEI COS dollars for non-Medi-Cal? And the reason why I'm asking that is we have a new program where prevention, early intervention dollars were increased to do stepped care. And what we're finding amongst our groups is that we're doing a fantastic job of serving the underserved. Much better than we ever did because we don't have to show medical necessity. We're able to actually do true prevention work. Our agency actually subcontracted out to smaller groups to do some of the outreach because we believe those organizations know the community. The problem is trying to get money shifted from the Medi-Cal bucket into the non-Medi-Cal bucket without losing a big chunk of your contract. So to me, the solution is with all of our MHSA unspent dollars in PEI, can we move forward rapidly and shift a lot more money into PEI COS? And the second question is, can the department, and actually I've started working with the department, have more leverage with the developers to provide the activities in language? So mental health first aid, which you mentioned, is one of these programs that only has Spanish and English. And at the summit, we brought up the fact in LA County, we have Korean, we have Cambodian families ready to move forward with mental health first aid, and they cannot because it's not translated.
Yeah, I'll take the second question first, so in a way it feels a little bit easier. But the answer is yes, and I think with any practice, and you mentioned mental health first aid, send me an email about, well, in this case you don't have to, but where these things come up, send me an email with Carrie Casanti and others to be able to work with the developers. I know that very early on, as you know, with many of our EPs, we negotiated all of those sorts of things and were largely successful, but we'll definitely do that. And then on the shifting of dollars, let me take that, and that's a kind of a Greg and Terry question. I'll take it back to that, because conceptually it would seem like we should be able to do that, but that's their area, and I know that we've been talking about shifts this week for other things.
And we have another question here.
Hi, I'm Wallace Taylor. We just recently had an African American conference, and in that conference, dealing with trauma, we're learning that the different types of trauma evidence-based practices doesn't really address African American needs. So I'm hoping one of those that seems to be promising that I'd like to see you test is EMDR. And that seems to have worked, and not only worked, but worked faster to help address the issues of systemic trauma, intergenerational trauma, and other types of trauma that takes and turns it around quicker. It's a little more difficult because of the cost to do it and the training, but I think with MHSA, we have the latitude to test the concept and to do it and try it in these communities. And the unique thing about it is that we need to look at where the African American communities are, such as in SPA 8, 6, and 1, that's where the majority are. And then if it works there, then to the rest of the areas where the African American community, like Coima and other places, so that we can address the systemic trauma that they're experiencing, the adverse experiences for these children and families. The other thing is that I would like to know if we can model through innovation the concept of addressing and helping the African American community with birth disparities based on these traumatic experiences, where we're having more African American babies dying, African American women dying because of the traumatic experiences they've had. So I want to know how we're going to partner with people like First Five LA and what they're trying to do around that issue, DTH, and also modeling concepts that address the issue way up front, when before the woman has the baby, when she's having it, after she's having it, and addressing the family. Because that's a serious issue in our community, okay? So I know you can't answer it now, but I want to put it on the table, okay?
I appreciate that, and you know, on that part, the last part, I think that's more going to connect with Debbie Allen and public health, and we'll, I think in the next year or so, you're going to see a lot more focus in that area. And
I want a model, I want a concept, I want you to put it on the table, make it happen, so we can get data to prove that it works. So we go up to the nation, the federal government, get the money to make sure that that doesn't continue. That's all I'm saying.
no, absolutely, yeah,
And you
and,
can work with me.
and with prevention, I think you have to demonstrate logic models and then collect the data.
Yes.
And then on the NPR, that's intriguing because I think we're going to be very open to practices that have demonstrated impact for different cultural communities. If you have any literature on that, you can send it over to me. If not, we'll all have to carry it into the NPR.
Well, Ventura is doing it already. So, you can go online, do the EMDR, and try to, and then you'll bring up what they're doing in Ventura County.
Okay.
And Daisy, we have a question here.
I just want to talk about, I live on 52nd and Broadway, on the side of the freeway. And every time I walk out of my house, I see tents. And I see tents all the way alongside the freeway. And I talk to these people and I engage with them because I'm certified. My name is Velvet Victoria. I'm certified as a healthcare navigator, mental health CPR. I have every certification, including the coordinator that DNH offers. Now, I believe that if you wait for those people to come to your clinics, you will never have nobody there. And we need to have people that go out and actually give people mental health CPR.
That part.
Breathe life into these people, breathe hope into them.
That's
You
it.
can build all the buildings you want, but if you can't get them people out of the tent, they're gonna be out there and they're gonna die.
Yes.
And I want you guys to address that
Yes.
immediately.
Yes.
And
Yes.
fund
Yes.
organizations.
Yes.
I'm a part of DNH.
Yes.
I want you to fund outreach and fund small organizations to be your boots on the ground.
Exactly.
I'm tired of looking at these people and calling them for help, and they've got their voicemails full. You hear me?
And
You
then
cannot
this is
help
great.
nobody, and if the people don't help themselves, if they're not well within themselves, they can't help nobody either.
That's
And
right.
you guys are actually sending people out that make people feel bad. And that needs to stop.
Yes.
Dr.
You
Shannon
have to
and
come around
Randy
quick.
Brown have focused quite a bit of effort on getting physicians to do exactly what they're doing.
They won't hire.
Okay, right now, this will be our